Welcome to SVGTV News for today, Wednesday, January 13th, 2021. I'm Triska Campbell with the details. St. Vincent's and the Grenadines now has 227 active COVID-19 cases, 49 recorded today, and 31 last evening. This now brings the total number of confirmed COVID-19 cases in SVG to 333. At a virtual news conference this afternoon in Zoom, Chief Medical Officer Dr. Simone Keyser-Beach said since the last update, more persons have been admitted for medical care at the Argyle Isolation Facility and at the Milton Cato Memorial Hospital.
We have a total of 18 persons admitted to the Argyle Isolation Facility, and we have another 4 persons admitted to the Milton Cato Memorial Hospital. The ill persons, some of them do have pre-existing conditions, and as we know, that increases the likelihood of complications. We have 2 persons who have pneumonias, COVID-related pneumonias. So we have 2 persons with COVID-related pneumonias and 1 person who has had what we have concluded is a cerebrovascular accident, which is a stroke. So those are the persons we have right now in care. In terms of the persons at the Argyle facility, only a few of those persons are ill in terms of significant or serious symptoms of COVID. The other persons are there because it was determined that they did not have adequate home isolation facilities.
Dr. Keyser-Beach also noted that most of the persons who tested positive for the virus are asymptomatic.
By about 5 different clusters, including churches and some workplaces. We still have some places, some persons that we cannot do a direct link to, but we are still working. We also have some reports, some evidence that some persons who came in and did their 5-day quarantine and completed their 5 days in the hotels, went into the communities and might not have complied with the complete 14 days in the homes. We also have evidence of persons known positive cases who, because of our protocols here, we allow stable persons who are positive, and as you could imagine, where we have over 100 positive cases active now, we allow persons, if we deem the home environment to be appropriate, we allow them to isolate at home. We have credible evidence of at least 3 individuals who did not strictly stay within the isolation rules in terms of entertaining persons.
Providing an update on her own condition after being advised to quarantine for 5 days, which should have ended last Saturday, January 9th, the CMO said she remains in quarantine along with the other health officials out of an abundance of caution.
So we all had PCR tests done as soon as we realized that we had been exposed previously, and then we had subsequent PCR tests after that. So we have all had negative PCR tests. So strictly speaking, on the advice of our infectious diseases specialists, we have been cleared. We have continued to have minimal interactions, however, and I think that is generally what everyone should do, whether or not you have a known contact with a positive person. It is advisable that you minimize your contact with everyone. And whenever you are in contact with someone outside of your immediate family bubble, you should be wearing your mask. So I am still working from home mainly, working from home.
The backlog of the processing of the COVID-19 test has been reduced significantly. This was noted by Chief Laboratory Technician at the Molecular Lab, Elliot Samuel, during the virtual news conference. Samuel said that they are closer to processing all 900+ samples.
Looking and revisiting our process, I can say that we have caught up with the backlog, and as of today, we are closer to processing all of the samples that we have in lab. I know just about 2 days ago, we had reported that we were about 921 samples behind. As of last night, we were able to bring that deficit down to about 394 samples that had not been processed. The staff, as we speak, are at the laboratory processing all of those samples, including all the samples that were collected yesterday. So by the end of today, I think we can say that we have caught up on the backlog, and we'll be able to focus on the samples that will be coming in on a daily basis.
More than 24,000 PCR tests have been processed to date, which according to Samuel includes exit screening and retesting on entry cases.
Our diagnostic capacity, we are now looking, well, actually when we started, our capacity hovered around processing about 300 samples a day. And we are now doing, on many instances, around 500 samples per day. And these include persons who are coming in for exit screens, the flights that we are getting that we have to do entry screens on, as well as the public health cases in terms of the suspect cases and the contact tracing. Issues that we've been having recently in terms of our ability to turn out results at the laboratory, where we are experiencing some delays in terms of being able to give people their results in that 24 to 48 hour time span.
Samuel also noted that more reagents have been ordered, which would enable more tests to be done.
And we have since ordered new reagents, supplies, consumables to allow us to do an additional 25,000 tests. Those reagents and consumables are en route to St. Vincent. I know persons are experiencing many challenges where acquiring resources for testing is concerned. We do have our challenges, but the very important things we do have on the ground, and we have been lucky enough to have suppliers who can meet our demands. We're actually expecting some critical supplies in country in about a week or so. So we have not gotten to the point where I can say that we are short on laboratory supplies.
And Prime Minister Dr. Ralph Gonsalves, who spoke at the virtual news conference, said the COVID-19 situation is not overwhelming the health authorities, who have been doing their best with the resources available to them.
The staff spread across the country, because we have sought to focus on boots on the ground epidemiology, testing, contact tracing, and public buy-in, getting a consensus. So for instance, we have not done like some other countries to make the wearing of masks mandatory, but it is highly recommended.
The Prime Minister said that he does not foresee a national lockdown, noting that informing and educating the people is key in the response to dealing with the virus, as there needs to be patience and a calm.
We get the public buy-in, and we are a disciplined people overwhelmingly, and people listen to what is happening, and they're taking sound advice and acting accordingly. And we have seen this from the very beginning. We didn't get ourselves involved in states of emergency or curfews because we considered appropriate to our circumstances, not to other people's circumstances. And I'm very happy to hear what Dr. Gabriel said in this regard. We fashion solutions, even though they're universal principles, they have to be applied with a particularity.
Leader of the opposition, Dr. Godwin Friday, is holding the government accountable for the spike in the country's COVID-19 cases. Dr. Friday, who was addressing a news conference today at his party headquarters on a number of national issues, including COVID-19, is of the view that there was no sense of seriousness in dealing with the pandemic, which led the people to become complacent.
On the one hand, you have the Prime Minister and other members of government who were giving the impression that we had this thing licked, that it was beaten, the worst was behind us. That creates a sense of complacency, not just amongst officials, but amongst the members of the public, because you're essentially telling them things are getting back to normal, when in fact the situation now is worse than it has ever been. We are now, per population, one of the highest risk areas in the world. The government, quite simply, has mismanaged this problem. They became boastful as though it was a competition and they were winning. They also became complacent and they have allowed the situation to get out of control.
The opposition leader said there are also many unanswered questions about the country's COVID-19 situation.
We have the capacity to treat the people who get sick effectively. We all know that our healthcare system is not equipped to deal with an outbreak. What about ventilators? How many? Do we have the staff to operate them? Because you know sometimes you have equipment here, and if the technician doesn't come to work on a Monday morning, they can't operate. What is the current positivity rate for the recent tests that we get the results back for? Because that tells us what we may expect over the next few days.
According to Dr. Friday, COVID-19 should not be politicized, as interests of Vincentians should be taken into consideration. Luck has run out in dealing with the COVID-19 in SVG. That's another view shared by the opposition leader at today's news conference, who told members of the media while he is thankful for it, it is now time to seriously address the pandemic and called for ports of entry to be further secured. The ramping up of testing and enforcement of quarantine measures
has been brought upon us now. So we must enforce the quarantine measures strictly through effective monitoring and follow-up. As part of this, we must ensure that resort guests stay on the resorts until the mandatory quarantine is completed. From high-risk country, that's 14 days. I've heard complaints that there are different quarantine procedures for different kinds of hotels. The concept of a bubble resort, and that persons in those facilities are not being strictly monitored. I believe that the testing should be ramped up even more. And of course, this has to be done on a continuous basis. A person who was tested in August last year, is not out of the woods, so to speak, because you can become infective afterwards.
Dr. Friday said the wearing of masks should be made mandatory and that there is also a need for identified public awareness campaign.
This is a personal hygiene, so that we could overcome this, this notion that there is COVID fatigue, that people are tired of it. It's part of human nature. But we can't let our guard down, as we can see from the recent experience. So we must continue with the aggressive public awareness campaign. I would like also to see more hand washing stations around town, particularly at the bus terminus. And to help the van drivers, the government must provide means in place to help them to sanitize their vehicles. The wearing of masks should not be an option. They should be mandatory in public spaces. You can't say that you're reducing the number of persons in a van. You think 6 people in a van without masks is that much safer than 12 people in a van without masks? So then to do so, we have to make the mask more widely available.
When asked if he will take the COVID-19 vaccine when it arrives in the country, the opposition leader answered in the affirmative.
Be advocating for people to take the COVID vaccine?
Yes, I would.
Will you possibly?
Yes, I would.
Okay.
If it's available, I would. I'll do it right here if you want.
And on his weekly appearance on NBC Radio today, Prime Minister Dr. Ralph Gonsalves said that there are 2 board documents and policies and plans of which guides his government and by extension the Ministry of Health, Wellness and the Environment in dealing with COVID-19. The documents are the 2019 National Health Multi-Hazard Plan, which the Prime Minister Gonsalves said is constantly being revised, and the highly infectious disease preparedness and response plan.
Plan was finalized on October the 1st, 2019, and is under constant review. And then, within the framework of that National Health Multi-Hazard Plan, there is what was finalized in April of last year, the Highly Infectious Diseases Preparedness and Response Plan. This original draft plan didn't have COVID in it because there was no COVID at the time when it was originally drafted, but had to be updated because of the pandemic declared on March the 11th, 2020 by the World Health Organization. Now, these are the broad plan documents which we have guiding us.
Other than these documents, the Prime Minister Gonsalves said there are also particular work plans and programmatic activities in the fight against COVID-19. He said persons need to understand that though COVID-19 is very serious, it is not a death sentence, noting that the knowledge of the virus has increased to a different approach required.
He said that what we will do, we will ramp up measures where that is necessary and desirable, as the circumstances admit. And we will scale down as the circumstances demand. We will focus a great deal on boots on the ground epidemiology. That is to say, to have the nurses, the doctors, the other frontline persons doing the work of identification and contact tracing, do testing, and that we would emphasize certain protocols: physical distancing, social distancing, hand sanitizing, and wearing of masks.
The Prime Minister further noted that though SVG never closed its borders, a number of protocols and restrictions were put into place to prevent the virus from coming in. However, he noted that strangely a lot of persons in the country became infected with the virus. Dr. Gonsalves said that the Ministry of Health is now checking to see if the new strain of COVID-19 has entered the country.
By and large have worked, but we are seeing new strains of this virus. And we are checking with CAFA to see whether any of the new strains, the mutations, have come to us. The suspicion is that maybe, because people are mobile. And by the way, those who have closed their borders, certainly in the region, are in no better position than we are. All around, in an all-wrong sense, with life, living, production, the education, the social issues, the security, and of course, the health and the economy.
Meanwhile, Prime Minister Gonsalves said enforcing the wearing of a mask in SVG will be problematic and that he does not think it should be made mandatory.
Enforcing it would be problematic. You have to, if you have a law, the law has to make sense from a standpoint of a reasonable enforcement. In the real world, everyone over the age 10 years and over in this country can be arrested for an offense, a criminal offense. You want to make masks mandatory for everybody, including children, so the police will go and pick up 10-year-old, 12-year-old, 13-year-olds.
The Prime Minister said if the wearing of a mask is made mandatory, it will require policing to ensure it is enforced, and it will require a lot of resources, which is already limited. He said once persons are educated about wearing a mask, they will automatically fall in line.
You're gonna have a problem taking the police resources and going with that and leaving real serious crimes unattended. You're clogging up the courts with certain things. So on. Look, where masks have been made mandatory, I just read in the paper this morning in the US, in the UK, after the Home Secretary said she's cracking down. We saw a lot of people in shops, supermarkets, on the transport system not wearing the mask. They apparently didn't get the memo. What we have to do is to educate people, sensitize people, and say, listen, in all the circumstances, it's better that you wear the mask than not wear the mask.
Also on radio today, the Prime Minister announced that the Minister of Transport and Works, Montgomery Daniel, was hospitalized yesterday at the Georgetown Medical Complex and made it clear the minister does not have the coronavirus. Dr. Gonsalves said that there has been a lot of rumors going around about the minister's condition, and they are not true.
Was hospitalized yesterday in Georgetown. Naturally, if you're 66 years old and you're in the business in which we are, they'll check you for everything, including to see what's happening to your heart. I can report, even though he doesn't give him permission to say it, because the doctor told me that, you know, the inquiry into the heart, it's fine. Last week, both on the rapid and the PCR last week, Wednesday, he tested negative for COVID because body got tested. He got tested again in the hospital yesterday for COVID. It's negative. People do get sick, you know.
Two scientists from the Montserrat's Volcano Observatory were expected to join their colleagues from the Seismic Research Center to help with the monitoring of the La Soufrière volcano, arrived in state earlier today. In the last update provided by the National Emergency Organization NEMO, it noted that the alert level remains at orange and that the volcano continues to exude magma on the surface, and the steam can and still will be observed from the Belmont Observatory. It said persons living in It said persons living in areas close to the volcano should expect strong sulfur smells for several days to weeks, depending on changes in wind direction. It also noted that the SRC team led a mission on Saturday, the 9th January 2021, with the assistance of a drone pilot, Romel de Freitas, to test the feasibility of using the drone for aerial surveillance on the volcano, and the mission was successful, concluding that useful surveillance work can be done with drones from a particular location at the crater. The CSR team also completed installation of the seismic station in Oya on Sunday and were preparing equipment to be installed at the Summit Station this week and Fancy Station next week. It was announced yesterday that the Caribbean Disaster Emergency Management (CDEMA) has finalized helicopter support for the Seismic Research Center, a team to install equipment and collect samples from the summit of the volcano. In light of the spike in COVID-19 cases, NEMO has suspended all face-to-face community meetings to update residents on the present state of the volcano until further notice. NEMO continues to remind the public that no evacuation order has been given, and it continues to appeal to the public to desist from visiting the La Soufrière volcano until the scientists have advised to do so. The Eastern Caribbean Supreme Court, ECSC, today commenced the new law year 2021 with a virtual ceremonial opening in the form of a church service and a special sitting of court in St. Lucia. There were simultaneous sittings in the other 9 member states and territories of the OECS, including here in SVG. The feature address at today's special sitting was delivered by Chief Justice Her Ladyship Dame Janice Perea, who spoke on the theme "The ECSC Managing the COVID Quake," in which she highlighted difficulties of the COVID-19 pandemic and how it has affected the court's function in 2020.
Unfortunately, over the last year, the COVID-19 pandemic significantly hampered the court's ability to effectively manage its caseload and has laid bare the weaknesses and challenges faced in an already under-resourced environment. In several of our member states and territories, the pandemic grounded the conduct of jury trials, due mostly to our inability to provide the required proper physical distancing protocols in many of our existing courtrooms.
In light of the COVID-19 pandemic, the Chief Justice made a recommendation to promote the timely and fair execution of the course of justice.
In my view, the time is ripe for all governments, in consultation with civil society, to engage in discussions on the implementation of judge-alone criminal trials for specific case types within the context and framework of the constitutional mandate of fair trials within a reasonable time. I have no doubt that in this COVID climate in particular, the implementation of judge-alone criminal trials would go a long way in reducing the backlog of criminal cases in the Eastern Caribbean, with no impact whatsoever on the fairness of such trials.
Despite the challenges presented, Chief Justice Perea says there were several positives which emerged from the pressures of COVID-19.
The COVID-19 pandemic has forced the court to deepen its reliance on information and communications technology tools in order to optimize efficiency of operations. The e-litigation portal is a platform providing for the electronic filing of court documents. It has made a positive difference in so many ways. The ease of filing, the ease of serving, the ease of paying, and the ease of accessing and managing electronic documents. The pandemic has brought about some positive results by forcing us to see and engage in the virtual world in ways that have become our new normal. Indeed, there is no doubt that ICT-driven courts are here to stay.
It also noted at today's ceremony that amidst a difficult year, the court was able to achieve significant progress in several projects, including a revision in its code of ethics, updating of sentencing guidelines, the creation of family proceeding rules specifically for the islands of Antigua, and the creation of court-connected mediation. Digital SVG, in a partnership with the Ministry of Education, has launched a novel initiative to ensure no child is left behind in terms of e-learning. The company's country manager, Fanta Williams, explained how the initiative to provide an internet package for students and teachers engaged in e-learning came about.
The e-learning initiative actually started pretty much soon after the announcement of the first case of COVID. So we would have started these discussions in early March. The Ministry of Education actually engaged us to have a conversation of the need to look at a platform that would be accessible to teachers and students so that they could engage both efficiently and safely.
The issue of connectivity is an ongoing topic when asked whether students will be able to reliably access Microsoft Teams for their online classes. Williams had this to say today.
With all technologies, there can be challenges from time to time, but what we have done to mitigate the challenges that you don't need data to be able to access Microsoft Teams. Okay. What you have to be is a customer of Digicel. You go into our app, My Digicel app. You go in there, you click you go into e-learning and you click on the plan that says e-learning. It's already featured showing that it's $0. Once you click that plan gives you access to the Microsoft Teams platform at no charge. Okay. So at that point, the only mitigating fact will be ensuring that you have good coverage, a good coverage area, okay, with which you'll be able to access the service. But it doesn't require you to have data on your phone.
The Digicel country manager says they are planning additional initiatives to assist students.
Another thing that we're looking at now is also some SIM-based offers that give some bigger data plans, because outside of the platform of Teams, there'll also be a need to be online doing research and all of these other things as well. So we are working on some other initiatives in that regard as well, and we're hoping to have those rolled out soon.
Williams also pledged Digicel's ongoing support to the Ministry of Education and commended the hard work that went into planning for the reliable learning platform and the subsequent registering of students and teachers on the platform. She said while there are alternatives, Microsoft Teams was chosen for its ability to record information, upload material, and control it, allows teachers to have over who can access their online classes. The Marico community of Richland Park turned out to be the biggest winners when the results of the 2020 Nine Mornings Festival competitions were released by the SVG Nine Mornings Committee this week. Richland Park, in addition to being named the National Lotteries Authority Nine Mornings Community for a second year in a row, also was named the Best Christmas Community and Zone 3 winners of the Vinlek Community Lighting Up Competition. The other big winner for 2020 was Point Village, who won the Vinlek National Lighting Competition for a record extending 8 years in now opting Point Elizabeth, Rose Hall, and Top Belair in that order. Point Village was also adjudged as having the best nativity scene. Soca artist Luther McIntosh won the most popular local Christmas songs with his composition It's Christmas Again, with Carlton CP Hall in second place with Christmas with Corona. The SVG 9 Mornings Committee also released the results for some new competitions held in 2020 festivities. Spring Village was adjudged to have the best health protocols. Sionic Sutherland won the best face mask competition. Uriah Little had the best song in Digital's Bring Your Song and Come competition. Close to 50 communities participated in the 2020 9 Mornings festivals, which were held under the theme Keeping the Christmas Spirit Alive.